All in all, a very good day here at home. I wish it was the case across the country yesterday. More often than not, we saw heroes here in Michigan and Metro Detroit, in Troy, in the city of, and in all of our communities, of finding ways to not cause trouble, finding ways to not loot, finding ways to protest in a peaceful way, and more important than anything else, finding ways for the police and the community and our leaders and everybody to get along. Meanwhile, back to the main focus of this little old radio and television broadcast. The governor yesterday had a very big announcement, and the stay-at-home order is gone. The stay-at-home order is finally gone. I wish we could have a big party, but we're too darn busy to have a party today. So we'll talk about that. In fact, hear from the governor in just a couple of moments. This is the Megacast. It's more than just a radio or television or cable TV or online broadcast. It is all of the above. We are today on 89.3 Lakes FM in the West Bloomfield, Keegle Harbor, Sylvan Lake area. WBFH 88.1 The Biff in Bloomfield Hills and beyond. WAHS 89.5. It's Avondale Community Radio, broadcasting from the Pontiac, Auburn Hills area and across much of Oakland and Macomb County. Thank you for watching us on Channel 15 if you live in Birmingham, Bingham Farms, Beverly Hills, Franklin, West Bloomfield, Orchard Lake, Keegle Harbor, Sylvan Lake. You can get us on Comcast. Anywhere else, if you're an AT&T subscriber, go to the community channel 99, find West Bloomfield and click on there because that's where we originate from. Big salute today to the Walled Lake Consolidated Schools. Always brings us a huge audience on Facebook Live. You can find us there today. And, of course, you can always tune in to the broadcast on civiccentertv.com and watch the whole program. I'm Dave Scott. Tyler Keefe is here again. Tyler, it's a good day, Tyler Keefe, all in all. It's a good day.
It is. It's a beautiful day.
Lots of good news on the coronavirus front. Lots of good news locally, at least, on the protest front. But that being said, did you watch the news last night? Because that was the most depressing evening of television that I can remember in watching the news channels maybe in my entire life, but certainly right up there with anything we've seen over the last several years.
It definitely was. Seeing some of the scenes from places like particularly New York and Seattle throughout the many news stations that were reporting on this last night, it was very depressing, and it was sad to see things divulge into chaos again in many places, but it was also really nice to see things stay peaceful and show what good can come from all of this in places like Detroit and Troy.
Absolutely. Somerset Mall protests yesterday. In fact, right near where I am the other half of my day, literally a half a mile down the road, and it went unbelievably well. You've seen the story in the news. If you've not, at the pinnacle of the protest, police officers getting down on one knee like they're Kaepernick at a football game, okay? And the protesters responded, and there were hugs, and I don't think there were kisses, but there might as well have been. It was a beautiful scene, and let me tell you, they were ready. The Somerset Mall was boarded up yesterday. There were police cars everywhere. The Troy police were preparing, as they should have, for the worst, and we ended up with the best. And then how about that young man in Detroit from southwest Detroit, the 16-year-old who had a similar result in the city of? We'll have feedback on all of that. We got a lot of great guests. In fact, we're going to be talking to the Troy Police Department today. University of Michigan still has not announced their plans for the fall, but we're going to talk to one of the key people on that front. We're going to talk to restaurants that are opening up and a whole lot more, so stick around. Now, here is the other good news yesterday. Let's go to our clip from CivicCenterTV.com, and this is going to take a minute or so, but let's listen to the huge announcement from the governor yesterday.
Today I signed an executive order moving the entire state of Michigan to Phase 4 of the My Safe Start plan. I've also rescinded the Safer at Home order, provided that Michiganders can continue to do their part, wearing masks, social distancing, washing our hands, and keeping COVID-19 from spreading again. Later this week, I plan to issue an executive order to move regions 6 and 8 to phase 5. It will depend on the numbers, of course, and we'll be watching it closely. Local leaders always retain the ability to keep restrictions in place if they think they need them. I encourage local leaders to work with DHHS and the State Emergency Operations Center, to work with their local public health, and to work with their local hospital systems as they make those determinations. But the data has shown that we're ready to carefully move our state into this next phase. But we owe it to our frontline heroes to make sure we get this right. On behalf of our healthcare workers, our first responders, our grocery workers, child care, utility workers, and everyone else who's been working to keep us safe from the beginning, we all have to keep doing our part.
All right, we do need to keep the social distancing. We do need to keep washing the hands, singing the birthday song, right, Tyler? Let's see, social distancing, washing the hands. What was the third one? Social distancing. Oh, the mask. Wearing the mask. And wearing the mask. So keep doing all that. We're going to go through the order more specifically a little bit later on in the broadcast. But we have so much to get to. We do need to stay on schedule. But there was a governor. We'll hear more from the governor from yesterday's monster press conference where the stay-at-home order came to an end yesterday. And as a result, restaurants are finally opening up. But the only thing that's not really going to be open anymore is going to be the movie theaters and the salons, and so place to get your hair cut. But almost everything else is going to be open. Gatherings of 100 people. To me, that sounds like a big old backyard barbecue over at the Scott House. What do you think?
It definitely does, and it's nice to see that. We'll see a lot more people, I think, at the parks now than we have before.
Well, no, did they say in there, and we're going to get to all this in a minute, did they say in there that the state parks are going to open then on Monday as well?
That wasn't specifically put in there. They did mention that outdoor pools will be opened.
Excellent. Fantastic news. All right, let's go to this guy who has his hands full because with all of the good news, we are definitely having challenges at our schools in the state of Michigan. And we got Ken Gutman on screen right now from the Walled Lake Consolidated Schools. Let me just hit a couple of buttons, Ken, so we don't see the rest of our staff and have an opportunity to get your microphone on and say hello. Ken Gutman, Superintendent, Walled Lake Consolidated Schools, thank you for joining us today on the Megacast.
Good morning. Thanks for having me once again.
Well, it's good to have you here. And you know what? Pretty good day. Stay-at-home order has been lifted. We had a pretty good day yesterday during this tumultuous time with protests and rioting going on around our country. I think yesterday, and we'll get into your issues in a minute, but I'd like your thoughts. I think yesterday, we can safely say that Michigan and Detroit and Troy set the example for the country. Police officers get down on knees with protesters, and a 16-year-old kid, and I know you know all about 16-year-olds that are amazing because you see a lot of them every day, Ken Gutman. A 16-year-old does what nobody could do and stops the protests in Detroit. It was a beautiful day, Ken Gutman. What do you think?
It was a beautiful day, and that was a beautiful moment, and my hat's off to that 16-year-old. Look, the kids are going to have to lead us out of that, and that's why we spend so much time on diversity and equity and inclusion and social justice in the Walled Lake schools, and we still have a lot of work to do. Look, we have a lot of work to do as a nation, but if you want to look at a great day and look at the way it should be done, there were some great examples locally, and it was heartening.
Well, it was, and as we said just a couple of moments ago, I don't know if you could hear, but as good as that news was, it was so depressing to watch the news coverage from Washington, D.C., but more particular from New York and the West Coast where there's just a tremendous amount of looting. But at least now we can see the difference between the good guys and the bad guys. And there are a lot of really good people, and it is multicultural. This is not just the African-American community protesting. It's all of America. And Ken Gutman, you're right. It's awful lot of young people that seem to be leading the way. And I like what you just said. The young people will lead us out of this mess. Don't you think?
Well, they'll have to, because we haven't gotten it right as adults. And you look across our country, we're not where we should be. I mean, the Civil War was how long ago, and we still haven't reconstructed fully, right? So we have a long way to go. And so the work we do in the school district and other local districts do in terms of diversity and equity and inclusion, that's serious work, and our children get it. I can tell you my own kids get it. And it's heartening, again, to overuse the word, but it will be the children who lead us.
Ken Gutman, the superintendent of the Walled Lake Consolidated Schools, joining us here on the Megacast. Dave Scott, along with Tyler Keefe, in our studios. Ken, let's start with the money issues, because money is going to be a big deal as we try to recover as individuals, as businesses, as municipalities, and for school districts. And yesterday, we had folks on from the Southeastern Michigan Council of Governments. And it opened my eyes to the depth of the problem. I was only thinking about the challenges associated with next year's school budget, but this year's school budget doesn't end until July. Are you concerned about the money that you may not get from the state of Michigan before your fiscal year ends, and what impact that might have?
Sure. So I'm sincerely concerned about a proration, considering our bills are paid. Right, we balance our budget. We projected a budget a year ago. We've honored that budget. We've been fiscally conservative throughout the course of the year. To say that our last couple of checks from the state, where our fiscal year ends June 30th, will not potentially be there, or will be significantly less when we still have bills to pay, that's a huge concern. It's a huge concern. So I'm hoping we can get through this year. As far as next year, I would love to see our state pass a budget by June 30th. We have to. So, in terms of projecting next year's budget, we have no information except that it'll be bad. And not having our numbers means we're making up a budget on our best guess, our best assumptions, which could be wrong. So if we're overly conservative, we end up laying off people who shouldn't be laid off. None of them should, frankly. If we're under conservative, so to speak, or a little looser on our guidelines, maybe we don't lay off enough people, and now we have to change people's career paths in the fall, which isn't fair either. Either way, our kids hurt. So I'm hopeful our state will pass a budget in the next several weeks. We're on the clock. We have 28 days to pass a budget for next year.
Kenneth Gutman, the superintendent of the Walled Lake Schools, joining us on the Megacast. I know we have protests. I know we have a coronavirus. I know we have issues that are, I'm sorry to say, more important to everyone listening right now. But that being said, schools are not going to get the money that they were planning on getting, and they've already spent. And to me, that seems to me like maybe the biggest story in the state of Michigan that isn't being reported, or I'm blowing it out of proportion. Which one is it, Ken?
So, well, it's being reported in some areas, but not often enough. And frankly, there are big issues around our state, but this is a huge issue. And the thought of us not having the money, and keep in mind, moving into I don't want to say post-COVID like it's a thing, but moving into this post-COVID environment, it will cost us more to run schools. You look at just providing PPE, it's a significant expense. And so we have a long way to go there. Now, to be able to do that with fewer resources, and also to finish the year unable to make payroll potentially, now we have a big issue. So,
right. So are you being an alarmist by saying that? Because I want to get back to this. Because, it's one thing to say we're going to have a tough budget next year. And that's all I was thinking about. But it became clear to me yesterday it's a much bigger issue. And it might come right down to, will school districts be able to make payroll for their final payrolls to the end of the year? Because the state's not going to be sending the money. You're at the very end of your budget year. There's not much more you can adjust. You cannot deficit spend. I don't know if you can accrue things into the next budget year or not, but I don't want to put you on the line, but I want to make sure that we're clear, Ken. Is it possible that some of the bills of some school districts may not get paid this spring?
I would hope not, but yes, it is. And you look there are districts in far worse condition than Walled Lake Schools and some of our other local districts. Yes, it's absolutely possible. Now, the conversations I've had with some of our local legislators have led me to believe they're doing everything they can to hold off on a proration this year, and that next year could be a really bad year for us. We're going to take this 1 week at a time, and we're hopeful that this year we're not cut. We know that we will be next year, but obviously we hope not, because next year our costs go up in all that we have to do in terms of social distancing and other health issues. So we're starting off the next several weeks hoping that we get a budget that doesn't cut us, a budget for next year and a budget for this year that doesn't cut us. And then we head into next year hoping that we're able to do what we need to do for our kids with fewer resources.
Ken Gutman, I just want to make sure I understand the language, and I'm not being an alarmist unless I need to be, and I think I might need to be now. But when you say the word proration as it relates to this year's, that doesn't give you the ability to take dollars that you would get from the state and accrue them forward or backward in any way. Can you explain what that word means as it relates to the budget, just so we're clear? Because the way I read it and see it in the limited time I've had to research this issue is you get money for this year, and that's money for this year, and then there's money for next year, and you were expecting this much money for the end of the year, and if it doesn't come, you still got to pay your bills or not, really. So
Yeah,
am I missing it? Can you explain what that term means?
Yeah, you're not being an alarmist at all. So let's say that you had a mid-year proration. Let's say it happened in January, and say it's $200 per pupil. Well, you'll receive a prorated amount of that for the remainder of the year. So you'll receive less money for the next 5-6 months of our budget year. However, if we were to be prorated now, there's not enough time to make it kind of a low cut. It would be a massive cut that could impact payroll in a lot of places.
All right. Well, we should be seeing this on the front page of the Detroit News and the front page of the Free Press, and it's just something I didn't think about, and I'm concerned about it. Our thoughts are with all of the schools, and really with all the people that work for the school districts, and I hope it all comes together. There is money. The state has been allocated money from the federal government to help the state get through the coronavirus issue. But as I understand it, that money has to be spent on coronavirus COVID-19 matters. It cannot be spent on education. So we have a little bit of a crisis going on here. The only place I see a relief valve here is a federal government, and we're all asking, right? But again, am I missing anything, Ken Gutman?
No, looking at the state budget situation, absent an unrestricted federal bailout that allows money and directs it to public schools or schools in general, we're a little afraid of next year. We have a lot more work to do for our kids. We want our parents and our staff to feel safe in our buildings, and it's hard to do that when you have fewer resources.
All right, let's get on to a better subject. Sorry to dwell on that, but I just think it's so important, and I really wanted to chat with you about it. Graduation, what's going on at Walled Lake? We're seeing schools build various graduation plans. Do you have a plan yet?
We do. June 14th, we're going to have all of our students so there are two parts to this plan. Number one, we still have a graduation ceremony scheduled in the stadium at Eastern Michigan University. One of our high schools July 31st. Two of our high schools on August 2nd. We don't know the likelihood that will be permitted at that time. We do have classes far more than 100 and crowds far more than that as well. We fill a stadium for each of our commencements. But we're still hopeful to have those. On June 14th, we're going to have a drive-in graduation, big screen at our bus garage. Actually, we've got a great area there. We'll have a huge screen. It'll be broadcast on our local cable, I believe, or local radio station. That I don't have all the details on yet, but parents will drive in, graduates will sit in the car, and we have speeches and recordings and that sort of thing. We'll do all three on that day, and we'll have them spaced out enough to make sure that everyone's safe, but no one will leave their car.
All right. Ken, very good. I appreciate your information. I'll call Judy Evola and just see if there's anything we can do to be of any help with your project. I'll give her a call later on today. I've been in touch with her a little bit, so good luck with all that.
Thank you so much.
Our producers, in the notes they hand me every day, they do a great job. I never follow them, but they give me all these questions to ask you. They did suggest that I ask you about sports in the fall. Do you have any additional information about what you may be doing and what the MHSAA may be recommending? Even today, groups of 100 are permitted. It's beginning to open up. Any plans, thoughts, insight?
Sure. So no insight, but thoughts. We do have some guidance from MHSAA, and we do have the guidance from the state that we're able to hold some outdoor types of practices with appropriate social distancing. And of course, we have a league, and of course, we'll have to have district policy on this. So we need to figure out where all of those intersect. And then there are the types of things we need to figure out. How do you run a football practice with social distancing? I don't know. So we have some challenges ahead of us. It would certainly be great to have athletics, and we would love to see that happen. We'd love to start having practices, but we're going to take a measured approach and make sure we get it right and err on the side of the safety of our coaches and our students and our parents before we do anything.
Ken Gutman, you're making news all over the place. Or I've just not seen this reported elsewhere. You're saying the state has said schools will be able to hold outdoor practices soon, or this summer, or leading into the fall season, one of those. And that is guidance from the state and the MHSAA?
It's guidance from the state. MHSAA has another set of rules that how you would go about that. But I believe it was in yesterday's executive order to allow outside activities. So
all right.
We're working to interpret that and again, err on the side of safety for all.
Well, you're right. I mean, they have allowed outside gatherings right now in phase 4 of the opening of the state of Michigan, of gatherings of up to 100 people. You would assume that you'd be able to get 100 people together and hold a high school football or soccer or track and field practice outside, and everything will be okay. So we'll keep our fingers crossed, and hopefully everything will work out. Mr. Gutman, anything else you want to add today? Anything else in your mind that we should know?
There's a lot on my mind, but you don't have that kind of time today. I just appreciate being here and having the opportunity to talk with you. Whenever you'd like to chat, I'm around, and we certainly appreciate our community. The support for our schools has been incredible. We appreciate you sharing all of our information with the community.
Well, actually, now I keep saying to all of our guests who I've gotten to know very well through the program over the past couple of months, when we can, we should get together for a cup of coffee. Now it's put up or shut up time, right?
Let's do that. Let's 6 feet apart and chat.
Okay. Ken, thank you very much. We'll do that real soon. Good to talk to you, and thank you for your great partnership. And everyone at the Walled Lake Schools, we really have enjoyed working with you through this, and will continue to do so. And in particular, we thank you for providing so many viewers when we have your Facebook Live online. Lots of good information. Thank you, Ken Gutman, Superintendent of Schools, Walled Lake. We're going to be back in a minute. More of the Megacast. When we come back, we're going to talk to Dr. Preeti Malani, who is a Chief Health Officer and Professor of Medicine, Division of Infectious Diseases at the University of Michigan. Again, more than any one person should have to put on a business card, but we'll get to that in a minute. Dr. Malani is going to have some information about some of the planning and information going on as we decide whether or not to bring students back to Ann Arbor this fall, and a wide variety of other issues. We'll talk to her in just a moment right here on the Megacast.
Coronavirus is deadly, but Michigan can fight back. Our front doors are the front lines of defense. Staying home is the best way to stop the spread, because just one infected person can give it to 40, who can give it to countless more. So call Grandma, don't visit. Video chat, don't meet up. And if you must go out for food or medicine, keep at least 6 feet from others. Stay home, stay safe, stop the spread.
Technology like smartphones are wonderful devices to reduce social isolation in older adults. You can call grandchildren, phone friends, participate in fitness classes, and play games. But you need to stay mindful of scams. Scams related to the COVID-19 virus are rising. These include attempts to obtain personal information from seniors, including pitching unreliable products, advice, tests, and cures. You need to stay vigilant and be cautious. If you feel that you have been taken advantage of, it's okay for you to reach out to somebody you know and seek out advice, or even contact your medical provider. Thank you.
Our headlines today: the stay-at-home order has been lifted here in the state of Michigan, Insurance companies made a lot of money while we weren't driving our cars. Governor says, hold on, wait a minute. We want some of that money back. Bottles can finally be returned. If I could only get my hair cut, I'd be happy. But bottles can be returned very, very soon in the next couple of weeks. Somerset Mall yesterday, a major protest, this time in the suburbs. Headline, peaceful. Details coming up. 16-year-old in southwest Detroit also has huge impact. The nation watched as protests there and the potential for danger and harm averted yesterday, and much, much more. So we're keeping an eye on all those stories. Thank you for tuning in today in 89.3 Lakes FM, 88.1 WBFH, The Biff, 89.5 Avondale Community Radio, Civic Center TV, Birmingham Area Television, and CivicCenterTV.com. You can watch online. And big thanks once again to the Walled Lake Consolidated School District for all of your help today and putting us on your Facebook Live channel. Little radio, little television, little streaming, little internet, and it all comes together for the Oakland County-wide broadcast. Joining us now is Dr. Preeti Malani. She is a Chief Health Officer and Professor of Medicine, Division of Infectious Diseases at the University of Michigan. And Dr. Malani, thank you very much for joining us on the Megacast today.
Thank you for having me.
How do you get all that on a business card?
Well, you have a couple different business cards.
Okay. So help us understand. I assume you stand at the intersection of whether students are coming back to Ann Arbor, some activities elsewhere around the state of Michigan, understanding what's going on with the whole coronavirus and COVID-19. And I assume that you are working in particular on what the fall in Ann Arbor is going to look like. Am I on target there? And
Yeah, Dave, you are on target, and I'm one of probably 50 people who's very deep into this. There's not one particular person who is thinking about the fall. There are a number of different groups, the education aspects, the housing, dining, just everything from testing to taking care of students. And as you know, University of Michigan hasn't made a formal announcement about the fall, but it is expected that in the coming weeks, the president and other leaders will come to a decision and make that announcement. But they have done a number of town halls and expressed optimism about the fall.
Well, and I hope you don't mind me saying, because I'm all maize and blue, but I hope you don't mind me, sorry, Tyler, I hope you don't mind me saying that, but you're basically the only university in the state of Michigan that's not proclaimed a plan. And I understand you're obviously doing all this in a quote-unquote abundance of caution.
Yeah, well, I think, and again, my impression, not just from the state of Michigan, but from the Big Ten more broadly, in talking to colleagues, is some of them have come forth and made an announcement saying we're going to be back in the fall, but the details have not necessarily been worked out for everyone. And we're working from the standpoint of getting those details in order and making sure it's feasible and safe. I mean, the health and safety are leading all the discussions, and then just trying to figure it out, because you're really designing a campus for something opposite of what it's designed for.
Well, Dr. Malani, absolutely. What are the big considerations as you try to open up the campus in the fall?
Well, the biggest thing is making sure that just as a community, as a nation, as a state, that we're in a good place in terms of viral transmission. And, we're hopeful that we will be there as our state opens up. And then again, our students come from all over the world and all over the country. So thinking about just the arrival to campus and what that might look like. Is there a quarantine? Is there a testing procedure? And, some of this is, there are different scenarios to think about. But then once you are on a campus, campuses tend to be porous. They're not like a closed campus where no one else is coming or going, but thinking about how do you maintain social distancing? Because there are some places where the density is pretty high, thinking about classrooms and residence halls and some type of classwork in studios and performance. You can't socially distance. So what can you do to improve safety? And then, of course, social gatherings and all the things that make it fun to be in college. Like those are, in this scenario, more difficult to move forward. So thinking about everything from how do you get from point A to point B, to what does a residence hall look like? What does a classroom look like? And again, it's not just our students. We have brought back our some of the research staff, and it's been a good dry run for us to think about some of the potential issues that come up.
Dr. Preeti Malani, the Chief Health Officer and Professor of Medicine, Division of Infectious Diseases, University of Michigan, joining us right here on the Megacast. Thank you very much. I'm just thinking back to my college days, and I don't want to get into my college days too much, but, the Friday night social gathering, for lack of a better term, of most college students involves some pretty close proximity activities. And then just the cohabitation in the dorms, that lifestyle. I mean, next to living at home in a typical American household, I don't know of an environment where you're in closer contact with other people.
Yeah, and it's not just the close contact, Dave, it's the number of people that you're in contact with, right? So on our campus, for example, it's mostly first-year students that live in the residence halls, and most of our beyond first year, so second, third, fourth, fifth, onward, they tend to live in apartments and houses and some fraternity sorority houses. There's a combination of things, but it is that residence hall where you have 1,000 people in a building that creates some of the biggest concerns. So, I've been thinking about it more as like a reframe of what social activity might be. And again, this is assuming that we can find a way to safely move forward. But some of the things that where you have hundreds of people and thousands of people even, those can become a little more difficult, but you can definitely consider family units, the way we do with traditional families. I would think of like maybe one hallway as a family unit and roommates as a family unit and house as a family unit, and being able to contain differently in that setting, but then, sort of limiting the guests that might come into a space, all the common sense things that we're doing in our day-to-day life. And again, this is sort of starting in one place, and then maybe if things are better and we're not seeing a lot of spread, you could potentially dial back some of those restrictions.
Sounds familiar. Sounds like phase 4 getting opened up to me. No, I get it, Doctor. So it I think the easy thing would be to just close down the dorms. But based on what I hear you saying, is you're looking for alternatives. So maybe redesigning the activities that happen. Just like we're going to do as we open up the restaurants. So there won't be seating for 100. Maybe there'll be seating for 25. Tables will be separated. I was at a restaurant in northern Michigan where I spend my weekends. And it was really clear. There was silverware on some tables, and there wasn't silverware on other tables, right? So are you thinking about that kind of a scenario, or is it going to be a dorm-free fall at most college campuses?
I think the reality is most college campuses can't have a dorm-free year because there's not enough living space for people. And, Dave, one of the issues is for some individuals, being back will be too high risk for them. And I think in those scenarios, you need to think about alternatives, whether it's housing or remote learning. But for everyone else, if we can get folks back and they can all understand that what they do affects everyone else, that it's a shared responsibility, this social compact of sorts, it's an interesting scenario to think about. All of us need to work together to keep everyone else safe so that we can stay here. Otherwise, you're going to be going home early.
Dr. Preeti Malani is with us. She is the Chief Health Officer and Professor of Medicine, Division of Infectious Diseases, University of Michigan. Great to have you with us. So let's step back, talk about the coronavirus as a whole. Let's talk about the big predictions as to an impending peak this fall. Your thoughts?
Yeah, so, a lot of it's unknown. There's no quite crystal ball. We, as a state, Michigan was hit very hard. We were one of the epicenters early with the United States outbreak. And I think we've learned a lot in the process, and particularly making sure vulnerable communities, whether it's nursing homes or jails or certain places of business or homeless shelters, we're really thinking about protecting those spaces. And I think there's some individuals in the community who are really staying home and staying out of circulation. But for everyone else who's going to sort of get back to work, get back to hopefully some type of learning, school, sports, other things, there's not going to be a zero risk. So the big things are going to be trying to keep people out who have symptoms and coming up with ways to consistently monitor as employers to make sure people aren't coming to work sick, that there's not a sort of incentive to come to work sick, that there's alternatives to that. And then the hand hygiene, the masking, the social distancing, the things that have become part of our day-to-day lives will continue. And it's not going to be possible to completely always follow them, but I think doing our best and creating situations where we can have fewer people in spaces, but still try to enjoy a good summer and good fall in Michigan. The expectation is that we probably will see continued activity during the summer. Hopefully it will not take off and we can avoid outbreaks. One of the things I like listeners to know is that we can't avoid all cases, but I believe we can avoid outbreaks. And that is very important. To have uncontrolled outbreaks is something that will halt all the progress that's been made. And this is where the state has really done a lot in terms of just testing capacity, contact tracing, making sure people who are ill can be isolated. So all the basic things and making sure that there's a good plan in place as we start to open up.
So you're an infectious disease expert. Are there environmental or just other conditions that are beyond the control of cultural activities that we can implement here in the state of Michigan? For example, is it just likely to get worse as it cools down? Is it likely to get worse as we deal with the impending increase of the flu? Are there things that don't relate to our activities on a day-to-day basis that could make this fall more difficult?
Yeah, so that's a good question, and a lot of it is it's things working together. It's not one thing; it's multiple things. And as you note, Dave, the respiratory viruses tend to peak in the fall and winter, and we're expecting that to be the case this year because every year we see that, and many experts have predicted that we'll see a spike in coronavirus cases. So one thing we can do, though, is continue the excellent hand hygiene, the keeping people out who are sick, and also encouraging people to get flu shots to help prevent some of the confusion that might go on because you might not know what type of illness you have without testing.
Oh, really good point. What kind of research is going on at University of Michigan that you may be aware of? I assume you're working on vaccines. I assume you're working on treatments. Is that correct? And what's going on at U of M?
Yeah, so there's a lot of work, particularly on treatments, and some of that is we're one of many really hundreds of centers that are offering some of the potential treatments to patients who are in the hospital. So there's a group of my colleagues who are doing a lot of work to try to enroll as many people as possible in some of the clinical trials, both with remdesivir, which people heard a lot about, and that's available a little more freely now, but not to everybody. And not everyone would benefit from it. So we're trying to figure out those issues. We're also looking at a few other drugs and then convalescent plasma. So the idea that plasma from people who have had illness and recovered, and like when would you use it? How does it work? So we're part of one of many centers across the country looking at these different interventions. The vaccine work so far has not come here, to my knowledge. I mean, again, there are people who work on certain aspects of this, but there are about 10 or so vaccines that are pretty far along in development. And the NIH is helping coordinate some of that to really see the next step of studies, and we may end up being part of that.
With regard to the plasma and regard to antibodies, a lot of people are getting antibody testing. We understand that the first round of antibody testing may not have been as accurate as the tests that are out now. At least that's what we're seeing in reports in the media. But friends of mine, just from street level, friends of mine who have gone in and received the antibody test, they come out this, oh, darn, I don't have the antibodies, because they think it's going to give you some amazing shield. A, do we have any information about the benefit of antibodies and the benefit of these plasma treatments, or are we just experimenting and learning as we go?
So I think it's a little of both. So I think the easier piece to address is the plasma treatments. And at this point, there's not comparison data available, but that is coming. And there's some good safety data that's come out of the group at Mayo Clinic now with 5,000 patients. And it appears that the safety profile looks pretty good. And again, the use of the donor plasma has been in patients who have severe or life-threatening illness. That's been so far the case, but there's an interest in looking at it as a way to prevent illness and maybe also in milder illness. So that's one issue. The second question you asked is about the antibody testing, which is, again, a little bit of a separate concern. And it is, I would say right now, a little bit confusing and unknown. What is the role of serology testing? And again, this, in theory, if the test works well, it could suggest that you have had illness in the past or recently. It does not necessarily indicate that people are immune. And some of this is just unknown. And one of the cautions is don't assume that a positive test means that you can go out and do anything you want, because that is not the case. We're going to know more in the coming weeks and coming months, and hopefully we'll find a good way to use serology to both understand like what's been happening in our community, but also understand the meaning of the results.
Dr. Preeti Malani, Chief Health Officer, Professor of Medicine, Division of Infectious Diseases at the University of Michigan. I can only ask you what I have been exposed to through the media that I would suggest is not operating at its best in this current environment. What don't we know? What should we know? Are there things that you know that I don't even know to ask that you might want to share with folks?
Boy, that's so I think one is there are kind of a couple extremes. It feels like some people who treat this as like no big deal and I don't really need to worry about it. And I would caution those individuals that be careful, because everything we do affects everyone else around us, even if we don't perceive ourselves to be at risk of severe infection. This is not something that you want to get, even if you're young and healthy. You could be sick for quite a while and you can spread it to people. So be careful, because all of us depend on all of our behavior. The other piece is I think there's also a group of individuals who are so concerned that they're not even leaving their home. And I think that's also a concern. People should get out. They should enjoy the beautiful weather in Michigan, get some exercise, be careful, avoid crowds, avoid being really in close contact with folks, but try to do what you can safely, because in the end, we can decrease risk. We can't fully eliminate it. And frankly, being home and never leaving and never seeing anyone is also a high risk for your health.
Yeah, it is. And just a high risk for just your head. And if you're not feeling good emotionally, that can roll over to the physical. There's no question about that. So, Dr. Malani, I really appreciate it. Great. Thank you so much for your time. We'd like to keep in touch with you. Great input. And just the other thing I just want to suggest to folks, and you can comment on it if you want. We have a little window now where the hospitals are not overwhelmed. And if you have any other health issues, now is a really good time to address it. Like me, I'm trying to lose some weight this summer because I figure if I were to get COVID-19, I might do a little bit better if I'm in a little bit better physical health. If you have some other conditions going on and you couldn't get into the hospital or your doctor last month, the month before, maybe now's a good time to do it. So I just think that in addition to the mask, washing your hands, keeping your social distancing, maybe just a really good time just to think about, any other health issues that you have. What do you think?
Yeah, I agree with that. And I think we talk about the second wave of coronavirus. To me, the second wave of coronavirus is going to be patients that have not gotten the care that they need the last couple of months. And, some of that was out of necessity. Some of that was out of fear. The virtual visits are not quite the same. And so I know at Michigan Medicine, we've put a lot of thought into this, and across the state, across the nation, health systems are trying to figure out how to safely get folks in. There's been a lot of thought in that. It is safe to go get care. Please go and take care of yourself, because all these other issues can't be put on the back burner for any longer.
All right, Doctor. Well, we may not have been able to win as many football games over the last several years, but when you talk about the University of Michigan, the hospital and the research and the medical genius work that's going on in Ann Arbor is greatly appreciated. Thank you. And I'm not surprised that this is a great interview. Thank you for your time today. We really appreciate
Thank you.
it. All right. So, Tyler, I know a little bit of that hurt you being a Sparty, but there you go. There you go. Thank you, Doctor. We're going to take a break. We'll be back in a moment. So, restaurants are going to begin to open up here in our area. We're going to talk to one local restaurateur. The owner of the Grill in Sylvan Lake joins us next. This is the Megacast, and we'll be right back.
Hi, I'm Oakland County Executive Dave Coulter. Our top priority remains slowing the spread of COVID-19 in our communities. Please stay home, and when you must go out to an essential business, take precautions like social distancing and washing your hands when you come home. Because of the pandemic, we are behind in our response rate in Michigan. While you are home, please take a few minutes to fill out the census. It is more important than ever that we receive money back from our federal government. The census is Oakland Together.
I'll tell you what, Tyler, even if you're a Spartan, that was a pretty impressive couple of moments
It was.
with the U of M. Welcome back to the Megacast. Dave Scott, Tyler Keefe in our Lakes FM studios in Walnut Lake Road in West Bloomfield. But we're broadcasting all over. We want to thank 89.3 Lakes FM, 88.1 WBFH The Biff in Bloomfield Hills, and 89.5 Avondale Community Radio, Civic Center TV, Bama, Birmingham Area Municipal Access, and of course, CivicCenterTV.com. You can watch us there and also watch us today on the Walled Lake Consolidated Schools Facebook page. I thought the day would never come. Yesterday afternoon, the governor finally releases us from the stay-at-home order, and the news that restaurants and bars are going to be able to open. They did include bars in there, didn't they? Also, Tyler.
I believe that would be within restaurants.
I would hope so. They are getting ready to open as of Monday of next week. Joining us now is Vicki Kirker, the owner of the Grill in Sylvan Lake, and we check in with Vicki via Zoom. Great news! Congratulations! You all ready to get things rolling again, Vicki?
Yes, we are. We're pretty excited. 10 weeks of no customers is a long time. And at first, when she said we were open, the girl that was working with me were like, "Oh my God, we're so afraid. We haven't had customers in here in 10 weeks, and now to have everybody back, it's exciting. It's like reopening the first time."
It is. I know a couple of bartenders around Metro Detroit will be very happy to see me again. I can tell you that. But the reality is, I had the opportunity to be in Northern Michigan to report on their opening, and then because I go up there. And the thing that surprised me the most is there were not as many people in the restaurants the first day or two. So the restaurants got to figure it out. The people got to figure it out. It takes a couple of days. Do you think that the same thing's going to happen here?
Oh, absolutely. I know there are still a lot of people that are afraid to come in. And I think once they do, they'll see that, they're really safe here. Most businesses are having to learn how to sanitize for the first time. In the restaurant industry, we've always had to do that. So other than wearing masks and gloves, we will be cleaning with sanitizing solutions like we always have. I think people are safe in restaurants.
Well, I think they're going to be very safe, too. How are you going to make it work at your place? I was in a restaurant last week in Northern Michigan. It was kind of cute what they did. They put the silverware on the tables where you could sit, and there was no silverware or settings on the other tables. Some places are moving their tables and furniture around. What are you going to do to lower the number of people that are in your restaurant?
Well, we're going to be seating every other table, which my dining room is big enough that will give customers more than 6 feet between them. And we'll just close them off either with X's. I tried to get these monsters. I called them my COVID monsters, but I haven't collected enough of them yet for all of my tables. But hopefully by Monday, I'll have enough COVID monsters.
And tell me again, hold on. I want to make sure I get this in our vocabulary. Tell us again, what is a COVID monster?
Lauren, could you grab me?
We're going to see. Show us one. I want to see what it is.
COVID monster. And they sit on the tables that you're not allowed to be at. So.
Oh, I see. I get it now. I missed it first. Okay, hold on.
Hey, here's the COVID monster.
Oh, spooky.
And
he doesn't look happy.
Oh.
I love it. All right, so we're going to add that. We have a vocabulary. You can't see us, but the people at home can. We have our COVID-19 vocabulary, and anytime something like this comes up. Okay, so Tyler, COVID monster. And that would be, he does these really clinical definitions that he just pulls out of his back pocket. Let me see if I can do the best. COVID monster would be an intimidating stuffed animal placed on an unavailable table at a restaurant to prevent those from sitting there. Is that definitionally pretty close?
It works fine for me.
That's pretty close.
All right.
About right.
So where do you get these COVID monsters, and are they all identical, or do you have different looking COVID
They
monsters?
look different, and we purchased them at Myers.
Okay. So will you be changing your menu or your food or any of the other things to make it easier to comply with the rules?
We have downsized our menu a little bit. We're using single-use disposable menus or QR codes that will be at the table, so you can just scan the QR code with your phone and look at our menu that way and never have to touch anything.
Get out. I love it. So you're going high tech. How did you do? I mean, the last time we talked to you, I think it was near the end of March when things are shut down, and you did some curbside service, I know, and some carry-out service. How did that go? How you doing? And just, again, your general thoughts as you get ready to open up on Monday.
Curbside worked out really well. We had so much support from a lot of our regular customers, even had some new customers through it. It was actually kind of fun.
Okay, and what are your hours going to be when you reopen?
We've shortened our hours a little bit, where we open at 10 a.m. and close at 10 p.m. And then on Saturdays and Sundays we'll open at 7 a.m., but on Sunday we're going to close at 4.
So you have breakfast.
We always did a big breakfast on the weekends. I make my own butter rum syrup. We have all these specialties, these Mexican breakfast specialties that we invented that nobody else has, and just some fun stuff on our menu. So we've always had a very busy weekend breakfast.
Tyler, I don't know what you're thinking, but I'm just thinking, let's see, so you'll be open Monday, right?
Absolutely.
At what time on Monday?
10 a.m.
You know, that's when our show goes on the air, Tyler. 10 a.m. on Monday. And they're going to have, you'll have coffee there, right, Vicki?
I will have coffee.
Yes.
Decaf and regular.
Well, let me just ask you live on the air so you can't say no. But do you think you reserve a table for us? Maybe we can get in there a little early and we'll just do the show, or at least I will do the show from your restaurant on Monday. What do you think about that?
Actually, that would be a lot of fun. Of course I will do that.
Do you have internet right there?
I do.
All right. So our producers are going to get in touch with you and work on it. Tyler, of course, will have to stay here at the studio because, someone's got to be the responsible party. But I don't see why I can't go out and have breakfast with Vicki, maybe, some other members of the team. And this is a huge day for us here. And I think we should embrace it with all that we can. So, Vicki, if you don't mind, we'll celebrate this with a live broadcast from the Grill in Sylvan Lake on opening day. Is that okay?
Fabulous. Looking forward to it.
All right, we will get together with you and put the
first beer, even though it's early.
You can I have a beer at 10 o'clock in the morning?
Absolutely.
Are there any FCC regulations that are
not
impacted here,
knowledge.
Tyler, that you're aware of? Okay, well, we'll probably just stick to coffee, but I appreciate the generous offer. We'll work on all the technical nuances to make it all work. Vicki, thank you very much. Anything else to add? Anything else to add today before we say so long?
No, I think we've covered it.
All right. I really didn't have an agenda to crash your place. Just kind of came up in my mind when we started talking to you, but it'll be a lot of fun. I'll see you on Monday, all right?
All right, thank you.
All right, well, there you go, Tyler. It's very exciting news. Restaurants are opening up, and I'm going to have to be very careful. I'm on a no-carb diet right now, but I bet Vicki's got some eggs and other healthy stuff I could eat when I go out there on Monday. So there you go. This is the Megacast. We're going to take a quick break. We'll be back in a moment and get to some of our other news headlines, and we're going to hear from the governor of the state of Michigan from her press conference yesterday when we return. This is the Megacast.
I know you're concerned about the coronavirus, and we're working hard to combat its spread and keep your family safe. But we need your help too. Wash your hands often with soap for at least 20 seconds. Avoid touching your face and cough into your sleeve. Replace handshakes with an elbow bump. Avoid large crowds or events, and if you're sick, stay home and call your health provider. Every one of us can make a difference limiting the virus's spread and keeping Michigan healthy.
Hi, I'm Dr. Jonay Caldoon. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
Forgive me, Tyler. I'm so impulsive.
I know. I'm aware.
All right, it'll be fun, don't you think? So Monday, we'll be live in Sylvan Lake for the opening of the restaurants, and we will be at the incredible grill in Sylvan Lake. I've not dined there for a long time, so it should be fun. See how it all goes. Eric and I will go out there. Maybe Ryan. Can we leave you here alone? Now we'll leave you with Ryan.
Yeah,
or
at
Eric.
least one person there.
Okay, I'll take one or the other, and
I'll flip a coin.
we'll head out, have breakfast. Live as Monday, they open up the restaurants here in Metro Detroit. That is great news. Okay, our headlines of the day, as we take a couple of moments before we talk to the chief at the vice chief at Beaumont Troy and their ER Center, Dr. David Donaldson will be joining us. But here are the headlines of the past 24 hours. And Tyler, it's really been an amazing period of time. First of all, as we just talked about, U of M has not yet decided what they're going to be doing about plans for their fall opening on their campus, but it sure sounds like students will be coming back, and they're just trying to put together all the details they have not yet announced. A 16-year-old in Detroit yesterday really saved the day. It was a 16-year-old from southwest Detroit who was able to bring people together with a speech he made, and the protesters responded well, the police responded well. From what I understand, and you've read the stories, it averted what could have been a very bad situation. And then they hand him a phone after it's all over, and guess who's on the other end of the phone? Mayor Mike Duggan, congratulating the 16-year-old. It was absolutely amazing. The other piece of news, and I don't know how these things pop up. There must be some social media networking or phone call network, more likely social media. And these things just happen. These protests just happen. And yesterday that happened in Troy. And listen, I'm in Troy every afternoon, Tyler. I'm there every afternoon, okay? I spend the mornings in West Bloomfield and the afternoons in Troy, about, a blink from Somerset. I had no idea all that was going on until I hauled out of the office at the end of the day and started driving up Crooks, and there are police cars everywhere.
Oh, yeah.
I mean, everywhere. They have the whole thing blocked down, and then I watch in the news protest at Somerset Mall, and a lot of folks saying, well, we're going to take some of this action out to the suburbs. And then I stopped at the grocery store, and at my grocery store they said, oh, do you hear this big protest going on up at the mall? And they got everything all boarded up, and I'm thinking, oh, no. This is going to be like that scene we saw last night in New York, but it was nothing like that. And yesterday at Somerset, the police handled that so perfectly. The Troy police handled it so perfectly, making all of us proud here in Oakland County. When the police officers got down on one knee with the protesters, and what do you think the protesters did? They responded accordingly. It was amazing. There was love, there was hugs, there was no looting, there was a peaceful protest. The protesters came, they walked down the street, a little bit of traffic was inconvenienced, the message was received, the message was transmitted, and beautiful, beautiful work by the Troy Police. We're going to talk to Sergeant Megan Lehman of the Troy Police Department coming up in a couple of minutes and just find out how that all transpired. But, Tyler, there's got to be a lot of social networking, because how do these protests just pop up, out of nowhere? It was amazing.
Yeah, I think a lot of times it's a group of people begin the protests themselves, and word spreads through social media, and people that agree with the cause or want to get involved will join in as well.
All right. We owe our stations an ID. We'll get to that in just a moment. And then just the other big news of the day we're going to try to get to as we can. If not, we'll roll over till tomorrow. But you can begin returning bottles in a couple of weeks. Insurance. The governor said the insurance companies were collecting a lot of money during the coronavirus the last couple of months, and none of us were on the roads. And the insurance companies need to offer up some refunds or dividends to all of us. We're going to talk to some folks from the insurance industry and get some feedback on how all of that is going to be working. I don't know. Well, I can't have any comment on it because I don't really know about it. But let's learn more about what's going on with the stay-at-home order being lifted. And yesterday the governor spoke to the state of Michigan. Of course, our cameras were there, and let's listen in to the governor talking about some of the services that will reopen on Monday, June 8th.
The shift to Phase 4 will occur in stages. Effective immediately, groups of 100 or less can gather outdoors so long as they maintain strict social distancing. Outdoor fitness classes are permitted so long as participants can remain 6 feet from one another. Office work that is not capable of being performed at home can resume, though you're still expected to work from home if it is possible. Drive-in movie theaters can start operating, and house cleaning services and other in-home services can also resume. On Thursday, retailers that have been closed can reopen with capacity limits. And on this coming Monday, restaurants can reopen for indoor and outdoor seating so long as tables can be kept 6 feet from one another. That means you must maintain social distancing in these places and wearing your mask and making sure that you continue to do your part. In restaurants, it'll be 50% or less of capacity so long as you're maintaining that 6 feet. Day camps can resume their activities subject to further guidelines on how we will keep our kids safe. That is next Monday. You can find a full list of businesses that may reopen in the full executive order at michigan.gov/coronavirus.
All right, michigan.gov/coronavirus. We'll put a link up. I got to believe we already have that link up on our website, Tyler.
I don't believe so, but we can get that up now that they have this information.
All right, michigan.gov/coronavirus. Let's get our legal IDs in, then we'll continue to talk about this. WAHS Auburn Hills, WBFH Bloomfield Hills, WBLD Orchard Lake. All right, that was a little minimalistic, but
gets the job done.
But it got the job done. So the governor just said it all. Groups of 100 outdoor social gatherings and events are permitted so long as people maintain 6 feet of distance from one another, and the assemblage consists of no more than 100 feet. The assemblage. I think I might be holding an assemblage this weekend. Drive-in movie theaters, I didn't see that. That's huge. So the drive-in movie theaters that were shut down on Monday, they'll be able to operate legally. Do you think we're going to see a bunch of pop-up drive-in movie theaters around the state of Michigan?
We may. I don't know if there's going to be too many of them, but I think there could always be a few of them.
I think there's going to be a bunch. Why not? The other movie theaters aren't open. And you want my prediction? Just my wild, crazy prediction?
They pop them up in the movie theater parking lot.
Yes,
there you go.
Exactly. Yeah. Did we already talk about that, or is that your prediction as well?
No, that was my prediction of your prediction, yes.
Yeah, I mean, why not? MJR, maybe they'll just put a screen up in their parking lot, and then we can all go over there and sing the MJR jingle, right?
Sure.
Can you sing that jingle?
Not now. No,
okay.
Not from memory. I don't have a problem.
All right. A lot of people can. And then do that. So because how many drive-in movie theaters are there left, for goodness sakes? Not many. So drive-in movie theaters are going to be open. And was that Thursday? That's Monday, right?
Monday.
With the other Monday stuff. Mm-hmm. Outdoor fitness classes, another category that We don't see a lot, but do you think the gyms now will take their equipment, put it in the parking lot, and open up and do outdoor? Let's see what it says. Whitmer's new order also allows for outdoor fitness classes, athletic practices, so that would be the schools and other training, training sessions or games, provided that coaches, spectators, and participants not from the same household maintain 6 feet of distance from one another at all times during such activities. Equipment and supplies should be shared to the minimum extent possible and should be frequently cleaned and disinfected. So let me see. Let me run some sports. Yes or no, Tyler? Okay, this is totally impromptu. You ready to play sports, yes or no?
Sure, let's go for it.
Baseball.
Yes.
Now, how do you maintain 6 feet when you're getting to first base? I would say no.
Okay, all right.
Football.
Football, I think that's a definite no.
Okay.
Too much contact.
The pools are going to open, so swimming, competitive swimming.
Yes.
I would think so. Soccer.
Soccer, I believe so, yes.
6 feet. But there's going
There's
to
contact
need to be some new rules, right? You know, maybe we can have 6-foot COVID-19 soccer.
I'm sure it's possible.
Yeah, I mean, if you're just playing yourself. And then either that or you just have to have, mom and dad versus the kids. You could play mom and dad versus the kids in any sport, right? So you can play like 2-person football on each side of the. I mean, I don't need to be ridiculous here.
Situation, yes.
Tennis,
definitely.
Yeah, tennis.
I believe
tennis.
so. Tennis, pickleball.
All right, so we'll work on the list of things that you can do, but there's more and more you can do. With regard to office work that is not capable of being performed at home can resume, but you're still expected to work from home if possible. And I think, moreover, people that have been working at home, kind of like working at home, might want to be able to do that. From the I wish I could get my haircut department, and a huge sigh of relief from Dave Scott. House cleaning services and other in-home services can also resume. I am not a very good housekeeper. I will fess up that I get a little bit of help in that department as a bachelor. So house cleaning service, how do you do in that department?
I do fine. I'm perfectly capable of
cleaning your home?
Oh, yeah.
I mean, my house is not terrible, but, I wouldn't mind getting a once-over now that it's been several months.
Why not?
For a professional. Allowed everywhere June 4th. When is June 4th? Today is the 2nd. So today's Tuesday the 2nd. Is that correct? Thursday. Thank you. While grocery stores never closed and other retailers were allowed to reopen by appointment since May 26th, the governor's new order will allow retailers across Michigan to open their doors on Thursday. First place you're going to go, Tyler?
That's a tough one. I'm not entirely sure. I'll probably just go to the pet store. I don't know. They're already open. But
they've been open. You got to go somewhere. You have nothing that you're dying. You've been waiting the last 2 months to go out and buy.
No, not really. Honestly, I really don't.
I do.
Good for you.
I do. Shoes. I need some summer shoes. Yeah. Shoe store. Watch out, shoe store. I'm just gonna. And it's no fun to make an appointment. It's no fun to make an appointment. Okay.
No, not for shoes.
So, like shops in northern Michigan already that have been reopened, retailers that open this week must comply with the new workplace safety rules, including mandatory face coverings for staff, and customers, smaller retailers with less than 50,000 square feet can only allow 25% of their usual shoppers. A little favoritism for Meijer here and Walmart and whatnot, but they're going to make it work. Now, when I was up north, I did not go in to the stores. None of the retailers. I just felt I didn't need to, and why expose them to some downstate guy? And I tried to do all my shopping downstate as was recommended. So I didn't spend virtually any time in the stores. I did poke my head just like through the door. They seem to be doing pretty good. We did that live, right? Remember? Yeah. So we were at the door of the one store, and we were live here on TV. And they seem to be doing okay with the limitations. And I think do you think that'll work out okay?
I think that will work out fine. I think it's much like Vicky Kirker said from the grill in Sylvan Lake, that it's gonna be a little bit of a process getting back to that normalcy for both the retailers and for their customers. I think it's gonna take a couple of days, a couple of dry runs before everyone's comfortable again to the same extent that they were before.
All right, and let's see, then allowed on next Monday, restaurants, bars, and more. Restaurants, food courts, cafes, coffee houses, Starbucks? Is that Starbucks?
I think that would be included, yes.
Bars. You know, I want to go out and have a drink, but for goodness sake, Starbucks opening. Now, that's big news, let's be honest.
Huge news.
Bars, taverns, brew pubs, breweries, microbreweries, distilleries, wineries, tasting rooms, special licensees.
Ooh.
What would be a special licensee?
That's a great question.
And clubs can reopen all across the state on Monday, but just like up north, downstate, restaurants and bars must limit capacity to 50% of their normal seating. If I had a sound effect of a big round of applause, Tyler, it would go today to Northern Michigan and the great job they did, because we would not be opening here in our neck of the woods had they skirted up in Northern Michigan, and they didn't. So that's the update. Huge day. A couple of other just quick notes. Required at some retailers June 15th. Bottle deposit return suspended since late March. Will also be partially resuming on June 15th, but you're only going to be able to get a limited number of bottles. You can go read that online. We'll have that online for you. And still closer now. Indoor theaters, cinemas, and performance venues. But could you have an outdoor performance?
I think that's likely. You have to keep your social distance, but you could have an outdoor performance.
I mean, 100 people, right?
Yeah.
Okay, so we want to have an outdoor concert for 100 people. We can do it.
I think that's feasible.
All right. Gyms, fitness centers, rec centers, sports facilities, exercise facilities, exercise studios, casinos, although some of the tribals can open because they can do what they want. Amusement halls, bowling alleys, on and on. Businesses offering non-essential personal care services, hair, nail, tanning, massage, traditional spas, tattoo, body art, and piercing still closed. That's the those are the final ones that will open last. And so other than some long hair, we're doing pretty good right now.
I would say as much, yes.
All right. Thank you for putting up with all that. Just wanted to make sure we're giving you the appropriate update. It is what we do. In just a moment, we're going to check in with Dr. David Donaldson, the Vice Chief at Beaumont Troy ER Center. We'll get in touch with him in just a couple of minutes. He is patiently waiting via Zoom. We're going to take a break, and we'll be right back. This is the Megacast all across Oakland County, bringing you the latest coronavirus and other information. We'll be right back.
Hi, I'm Dr. Jonay Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
Thank you very much for joining us across Oakland County on 89.3 Lakes FM in West Bloomfield, Bloomfield Hills, Kego, Sylvan, 88.1 WBFH. That is really the place to listen to us in Bloomfield Hills and Birmingham and all the way up through Pontiac, and WAHS 89.5 Avondale Community Radio, covering just a huge part of Oakland and Macomb County. We thank our radio stations. We thank Lake Schools for putting us on Facebook Live today. Greatly appreciated. You can also go to civiccentertv.com, civiccentertv.com, anytime you like, and watch the entire broadcast there. This little old show started out in West Bloomfield and kind of grew across Oakland County, and we appreciate the thousands of people that tune in online every day, and those of you that listen on the radio and watch on TV. I'm Dave Scott, along with Tyler Keefe, and joining us now is I had to get to the right page of my multi-page document for today. You thought doing this was easy, Tyler. People just think this. I just sit here and play around all day. Joining us now, Dr. David Donaldson from the Beaumont Troy ER Center. It says, Dr. Donaldson, you are the Vice Chief of the ER in Troy. Thank you for joining us.
Thanks for having me. I appreciate it.
Well, it's good to have you here. So before we get to the news of the day, you're Beaumont, Troy. It was a big day in Troy, so I spend my afternoons in Troy every day. I had no idea that what happened yesterday afternoon in Troy happened until I got out of the office at the end of the day. Were you aware? Did you see the traffic and the protests yesterday?
I was the same way. I learned about it after I got home.
So we didn't see that going on, but it was just one of a number of gatherings that have been going on. And as a Troy person, I hope you don't mind me asking something a little bit out of your area of expertise. Wasn't it great yesterday? I mean, we have so much to be worried and concerned and problems to deal with. Wasn't it great to see our Troy police officers get down on one knee, meet the protesters in middle ground, and now we are the shining example for the country. Doesn't that feel good?
Yeah, I agree. I mean, anytime you can protest peacefully and show solidarity between both sides, I think it's a great thing.
So we were talking to the folks out at U of M a little earlier, just in this hour, and one of the things we were talking about is people taking care of their own personal health as maybe another spoke on the wheel. You got the mask, you got the washing, you got the social distancing, but now that a variety of medical services are available, is it a good time to get back to some of your own personal health issues that might be helpful to get sorted out before we have another wave, if we do?
Yeah, I mean, absolutely. And that's part of the messaging that I wanted to get out there, is that it is safe to come to the hospital. We take every measure possible to keep you safe. In fact, at Troy, we have a nurse stationed outside of the emergency center. So when you arrive in your car, you are screened in your vehicle before even getting out. And if there's any suspicion that you may have COVID, you are actually brought out of your vehicle and into a separate entrance directly into a room. Never come in contact with anybody that potentially doesn't have it. So we segregate anybody that could potentially have COVID away from the general population, for sure.
Dr. David Donaldson is joining us from the Beaumont ER Center, and well, that's good news. And we've been hearing that from the other hospitals and medical facilities that we've been talking to, that they're just not seeing cases of people that are coming in to be treated for issue B leaving with COVID. And I assume that you keep track of that kind of thing, and we're just not seeing those cases.
No, that's correct. We get daily updates on our COVID numbers in the hospital, and it's a handful right now. And I quite honestly haven't seen a sick COVID patient. I mean, I've seen several COVID, not a lot, but a few, but nobody that's been sick like we saw several months ago. The severity, and I mean, I would basically say that curve is definitely flattened and is on the decline right now.
We talked to the researchers at U of M, but good to hear from you as well. You have a different perspective on this. Do you think, Dr. Donaldson, given what you've seen, given where we are, because you were looking at this thing right in the face of it several months ago, do you think we need to be concerned about influenza in the fall, the return of COVID in the fall, that we're going to see a spike, and that is around the corner for us? Your thoughts?
I think influenza, yes. I mean, especially in emergency departments, every year come about November, we do see spikes, and mainly that is due to influenza. So that will happen. COVID, I mean, this is new for everybody. I think we have to err on the side of caution. I am very reassured, though, what's happened recently with some of the measures being lessened in Michigan and other states, that they've not generally seen the big spikes. Italy is another good example that haven't seen the big spikes after the social distancing requirements have let down a bit. Some of that may be the summer months and the warm weather, but I think it's a definite good sign. So to answer your question, I think we have to have our guard up, but I'm reassured by what we've seen so far.
So, Dr. Donaldson, let's just go back to a little bit of basic, when do I go where? And we all forget, and it does make a difference. When should we go to the ER? I mean, we have the COVID scenario in there. For a while, it was don't come unless you're COVID or really in serious trouble. But getting back to normal times, when is it a good idea to head to our ER?
I mean, whenever you have what you determine is an emergency, and that can be chest pain, stroke-like symptoms, even like the ankle sprains and the arm injuries and everything, we've been seeing a decrease. And it's just really crazy the amount of the decrease that we've seen some of it can be explained. I think, without youth sports and things like that, obviously we're not seeing the youth injuries, but some things just can't be explained. The heart attacks, the strokes, even things like appendicitis have been like 50% reduction over this COVID times. And to me, that just means people are staying home and not coming in.
All right, Dr. Donaldson, I'm going to weigh in on that one because, and forgive me, I laugh. I'm just trying to keep this thing light as we can. But, okay, so Jeff, my producer of the show, he had his ankle was messed up. Should have gone in, didn't go in. Okay, it's getting better. You know, you got to decide whether a sprain for you or a sprain for me is going to be different. I get that. But I have had appendicitis. I cannot imagine having a full-blown appendicitis attack where you are vomiting profusely, just to be honest, and then not going to the ER. Is that what you think is going on?
Oh, I do, because we're seeing those patients weeks down the line when now it's perforated and they've got big-time problems when it could have been taken care of a week or two earlier. So I think these things are happening. They're just, people are not coming in. They're starting to now, but for the last couple of months, it's really kind of eerie, if you will, the amount of these things that you cannot explain that weren't coming in.
I always thought a perforated appendix, not to get off on a tangent, was a fatal scenario. Am I being over dramatic?
No, it certainly can be. The mortality when your appendix perforates goes up exponentially just from a simple appendicitis. So what can be treated in the first, couple days as a simple procedure now can be catastrophic.
All right. Are you hearing that the docs are having an opportunity, just that the general internists and family doctors are getting caught up with their patients? Or if you haven't been able to get in, is it appropriate to call the ER or is that inappropriate?
Well, I think, first of all, with the primary care docs, talking to my colleagues, they are working hard and they're getting their patients back and they're doing it safely as well. But that said, they are working extra days to try to catch up with their patients that, put things off for the last couple months. In terms of calling the ER, it really is a personal decision. You can certainly call your own physician to get advice. If you call the ER, the advice is going to be to come in because we can't very well screen emergencies over the phone. So if you think you have a medical emergency, I would tell you to either call your own physician or to come to the ER for treatment.
Dr. David Donaldson, Vice Chief at Beaumont Troy ER Center, with us today in the Megacast. We thank you very much for joining us. Just to kind of measure where we are with the coronavirus, I look at the traffic every day, and yesterday it was hard to pull out onto Maple and Crooks like it always used to be. For the first time, I'm thinking, oh, man, I'm going to wait 10 minutes to get back on the road. So I see things getting back to normal. You probably can measure that, too, by people walking into your ER. Can't you?
Oh, for sure. And our just to give you a sense, our volumes at peak COVID time, so, beginning of April, were about 50% of our normal compared to last year volumes. And again, those patients with those diseases were staying home, and some of them weren't having good outcomes. Now we're starting to see a trend back. We're currently at about 75% normal pre-COVID volume. So people are starting to feel safe and come back. And again, that message just has to be that if you have a medical emergency, we have a safe, place to see you.
And it's not just your ER, it's ERs all across Oakland County. I mean, you got to get back in if you're having a problem. And it is safe. You're not going to get exposed to COVID. So don't put it off anymore. Go ahead and get in and see your doc. Dr. Donaldson, are we ready if we do see, as we open up our state of Michigan and open up Oakland County, and we do, God forbid, have another spike? Do we have the swabs? Do we have the PPE? Do we have the testing? Are we in better shape for round two if it appears?
Yeah, we're in 100% better shape. There's a lot of lessons learned the first run through this. I mean, we were all new at this and thought what we did, was best, and we were doing what we could do. But we have a lot of lessons learned, even from the medical treatment to the way that we supplement oxygen, to the way that we use our PPE. And to answer your question, we have plenty of PPE right now. That wasn't the case a couple months ago when we were scrambling, but we do now. And the tests are there, yes.
Did physicians need to isolate themselves in many cases from their families?
In the beginning, everybody had their separate little process of what they did. We would never leave the hospital in clothes that we treated patients in, so we'd always change in our scrubs. My personal process was I got home, I stripped down in the garage, went straight to the shower, showered, and got a new set of clothes. So anything that I even had in the hospital never made it into my house.
All right, but I assume now, the reason I ask, I assume no one is doing that anymore. There's just no need, or is some of that still going on?
Oh, no. We all, as far as I know, all of my colleagues continue that. And in fact, today I'm just here doing administrative work, so I'm not even seeing patients, and I still follow the same routine. I'm just overcautious about it. I don't want to bring anything home.
All right, well, just make sure you got your pants on when you go out to cut your grass after stripping down in the garage, Doc. See, I could get confused, Tyler. That could happen to me, and then I'd have a whole other COVID-19 problem. So anything else, forgive me, anything else you want to share today that is of concern that people need to be aware of, Doctor?
No, I mean, I want to say thank you to the public because the message was to stay home unless you really needed us during the peak. And I think that did a wonderful job in flattening this curve. But I also think there was, some collateral issues with that, with people that were afraid to come in. So I just want to get out there that it's safe. I don't want to overshoot if there is another peak. So we have a safe segregated area if you don't have any infectious symptoms, and that goes all the way from the ER through your entire hospital stay. We don't mix COVID and non-COVID together.
All right. Well, good news. Thank you. Thank you for joining us. And back at you, Dr. Donaldson. We will always remember the heroic work done by the medical community, the doctors, the nurses, and then everyone at every hospital and medical care facility. Goes even beyond the medical practitioners. You guys, this was a war, still is. But you were all on the front line and taking risks, and we can look at it now. But you had no idea what you were in the midst of in those first days, and you did it because you had to do it. And we are greatly and forever appreciative. Thank you very much.
Thank you. I appreciate that.
Dr. David Donaldson, the Vice Chief at Beaumont Troy ER. Thank you very much for joining us today on the Megacast. We're going to take a break, and we'll be back in just a minute. We're going to go from the Troy Hospital to the Troy Police Department. In a moment, we're going to talk to Sergeant Megan Lehman of the Troy Police Department. It was yesterday at Somerset Mall that we had the potential for disaster, and then we end up being a community that the country looks to for an example. We're going to take a break. We'll be right back. This is the Megacast.
The Centers for Disease Control in Oakland County Health Division encourages households to prepare for the possibility of a coronavirus outbreak in their community. Keep extra items in your house for an extended stay at home. Remember any special food items for babies, the elderly, and pets. Keep non-prescription drugs and other health supplies on hand, such as personal medications, at least 1 month's supply, first aid kits, alcohol-based hand sanitizer, at least 60% alcohol, non-mercury thermometer, and get copies and maintain electronic versions of health records. Talk with family members about how they would be cared for if they got sick and what would be needed to care for them in your home. Learn about the plan at your child's school and your workplace. Discuss sick leave policies and/or telework options for workers who become ill. For more information, go to oakgov.com/health or call our Nurse on Call hotline at 1-800-848-5533.
Coronavirus is deadly, but Michigan can fight back. Our front doors are the front lines of defense. Staying home is the best way to stop the spread, because just one infected person can give it to 40, who can give it to countless more. So call Grandma, don't visit. Video chat, don't meet up. And if you must go out for food or medicine, keep at least 6 feet from others. Stay home, stay safe, stop the spread.
Still important to stop the spread, but you can stay at home if it's easier for you. You should still stay at home if you don't need to be running around, but you don't have to stay at home. The stay-at-home order has been rescinded by the governor, and that is really great news. We'll continue to keep an eye on the new orders, the restaurants opening up, and the bars and other establishments opening up on Monday, and the stay-at-home order is gone effective today. You're going to be able to gather in groups of up to 100 in certain circumstances. Keep your social distancing, and everything should be just fine. So it was a big day yesterday, not only with regard to the new orders from the governor, but nationally, a literally devastating day as we saw protest and looting that continues to get worse in some of our biggest cities. It was very difficult to watch coverage from New York and from the West Coast last night. Meanwhile, back at home, things couldn't have gone better. You heard about the 16-year-old in Detroit who was able to help avert what could have been a big problem in Detroit. And yesterday, the best example I think we've had anywhere in the country of how a police department can handle a protest right here in Troy, Michigan. Joining us on the line now is Sergeant Megan Lehman of the Troy Police Department. Sergeant Lehman, thank you very much for joining us on the Megacast.
Oh, thanks for having me.
So, we saw the report. We've seen the video. Police officers yesterday right in front of protesters, as we see at event after event after event, and a lot of dialogue and conversation going on. And then at one point, your officers, just like Colin Kaepernick during the national anthem in a football game, got down on one knee. And we understand, everyone knows the symbolism of that. The protesters got down on one knee, and then everything was better. It was an amazing day. Do you have anything you want to add or your thoughts, please?
Well, I think the officers were asked to take a knee, and it was organic. They felt moved to do it, and they are more or less taking a knee to stand, quote unquote, stand up against injustice. So we're pleased this event went well. We were there to keep the protesters safe, and they wanted to engage with us, which we were more than happy to do. It was overall a great event.
Well, it was, and you can never know in this environment how these things are going to go. So I assume when you knew a protest was coming to Troy, you had to completely prepare. Do you want to talk about that to the extent you can?
Sure. It's kind of like our job as police officers every day. We are out there hoping for the best, and usually everything goes great, but we do have to keep in mind the worst could happen too. So we do everything we can to prevent things. We talked to the organizers of this event beforehand, and we're grateful that they were willing to do that and work with us and kind of take our suggestions here and there, which is one of the reasons we were able to do this. And we were able to block off the streets since it was a very large group, so they could get safely from one area of the city to another.
Well, there had to be concern, just anecdotally, there was on my part, not knowing the whole story, that a protest would be happening in such close proximity to one of the region's premier and most significant retail establishments, given the way we've seen retail abused across the country. Was there some initial thought that a retail in your area, Somerset Mall, maybe some of the other retail, would be at risk, or did that not even enter into your thoughts?
Well, Somerset's a high-profile location in this area, so we are, right now we're looking at information that's out there, whether it's just jokes, which was mostly what we found about looting Somerset, but we're looking at every one of those tips or piece of information we run across and vetting them to assess whether there is a legitimate threat against Somerset. So again, we're just preparing for the worst. We're finding that last night was a peaceful protest. Those people that were out there were trying to do good, and they did a fantastic job, but we know there's elements in our community that might want to get out there and do some damage.
All right. Well, I appreciate your thoughts. Sergeant Megan Lehman joining us in the Troy Police Department on a day after a protest that I believe has caught the attention of the nation. Have you heard from other media outlets, or have you heard that what happened with the knee yesterday and the entire protest has been catching the attention of media outside of southeastern Michigan?
I'm not aware of any national media, but I think it's just important for people to know, because the more kind of publicity that gets, it looks kind of like a stunt. That kind of thing, it actually happens organically. In our case, at least, it did. Like, we are out there wanting to talk to these individuals and hear them, and we're definitely not looking for attention. So, in that respect, but if it does get on the national news and it inspires people in some way, we're happy about that too.
Well, and I appreciate the distinction, Sergeant Lehman, that it wasn't a stunt. This wasn't planned. There wasn't a phone call that said, hey, at 2 o'clock, we're going to do this. It's just something that happened organically, correct?
Yeah, that's correct. I mean, we're certainly going out there with intention. We want to interact with people as long as they're open to it, and we want to be friendly and approachable, but we're not doing this to get press, to get photo ops. We want people to know we're sincere in wanting to help them.
And it wasn't a perfect day. There was an incident with a protester who was struck by a car. And given the history of these events, we're always concerned when a car gets where it shouldn't, or worse yet, a truck. And can you tell us what happened there?
Sure. So this was a dynamic thing where we had probably 400 to 500 protesters at one point, and we determined the best thing to do for us to be to block off the roads. So as they got back to the end of this, which is a couple mile long march, there was still some traffic in the roadway at that time, and they took over an intersection, Coolidge and Big Beaver. At that time, there was a motorist that tried to go through, was stopped by officers, and then tried to go again and hit a protester. At least one or two. We're still investigating this, but he was arrested. That is an assault, and we are looking at formal charges. We'll have more information about that soon, hopefully.
All right. Well, when you get some information, we will follow up with you, and if you have anything you want to let us know, we'll certainly look forward to that. But that's unfortunate, and you don't have any idea, and probably can't talk about right now, whether that was just somebody that was inconvenienced and trying to get through there, or they were intentionally trying to interfere with the protest. Do you have any sense of that, or is it too early to know as your investigation is going on?
So what this person did, clearly not the right thing, driving into some people. Was it a situation where they were, coming out of nowhere and driving 50 miles an hour into protesters? No. But, certainly we arrested them. We're looking at what the charges might be. So it's still evolving, and we'll, dig into what his intentions exactly were, and we're looking at video from all different aspects.
Sergeant Megan Lehman joining us in the Troy Police Department. We've been talking to law enforcement across the suburbs the last couple of days. And, generally those in law enforcement, when we ask them about the situation in Minnesota, they say they're just mad that it's making all police look bad, and that there's training that should have prevented what happened, but they're just mad. Does that characterize the feeling of most of the officers in your department?
Yeah, it's mad and sad. It's horrifying on all levels. We're out here giving a good portion of our lives trying to make our community better and build trust, and that can be struck down and just by some horrible actions of one individual. But, we're also looking at this as an opportunity to look at the whole situation and look at ourselves and, what can we do better? What can we do to absolutely ensure something like this never happens in Troy?
And the suburbs are not insulated. We've seen a majority of the protests going on in Detroit, in Lansing, in Grand Rapids, in our major urban centers. But, I think the incident yesterday made it very clear that you might be in Oakland County, where almost all of our listeners are, but our communities here need to be on guard, need to be vigilant, and any day, regardless of a situation like that, I assume there needs to be dialogue between the police department and the community.
Yeah, absolutely. So, and now is not the time to start that. You need to start that, years ago. We've had an ongoing relationship in our community with all types of different groups. And and we're looking to forge some new relationships too. We've had people reach out to us, and we're always looking to work with people and learn from people, and that's where we're at. Like you said, the suburbs are not immune, and we've never thought we were. We have a diverse community, and we have a lot of people that visit our community from outside, and we want to just do what we can to make sure we're serving them the way we need to.
All right, Sergeant Lehman, thank you very much. Good to talk to you again. Let's keep in touch, and as you do work on your long-term outreach, if there's anything we can do, please include us in the conversation.
Will do. Thanks for having me.
All right, thank you very much. She is Sergeant Megan Lehman of the Troy Police Department, and, again, Tyler, confirming that was, no gimmick yesterday. That was just pure moment-by-moment decisions being made by police officers on the front line, and really good ones yesterday.
Yeah, it sounded from what she was saying like that was an organic moment that happened when the protesters had approached the police and said, hey, join us in taking this stand and making this gesture, and the police officers said, yes, we're on your side, and we agree with you, and we're going to show some solidarity by making this gesture alongside of you and continuing to support your right to your First Amendment rights and being able to gather and speak on major issues that we also want to solve.
All right, been a busy show today. We've talked to an awful lot of experts. We've got one more standing by. We're going to find out what's going on in Birmingham and just get the thoughts of that community. Joe Valentine, city manager, City of Birmingham, is standing by. We're going to check in with him in just a couple of minutes. Dave Scott, Tyler Keefe, this is the Megacast, and we'll be right back.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Hello, I'm Dr. Betty Chu, Chief Quality Officer at Henry Ford Health System, and I'm with Wright Lassiter, Henry Ford Health System's CEO, to talk about coronavirus.
In uncertain times, it's natural to have questions, so I'm going to ask Dr. Chu to answer some of the common ones. First, why can't I visit my grandma to see if she's okay?
Because the elderly are at a higher risk for complications with this disease, and you could inadvertently infect her.
If I'm healthy, why can't I go out with my friends?
The larger the crowd you're exposed to, the higher the chance you could get infected and infect others.
If I have symptoms, why do I have to seek care?
While the disease isn't dangerous for most people, for others it can be. We need to understand how serious your case is, because the right choices save lives. For more information, visit henryford.com or call 313-874-1055.
Thank you for joining us all across Oakland County. This is the Megacast. We are on radio stations. We're on municipal television outlets. We are on cable television via the internet. We are all over the internet with Facebook Live at the Walled Lake Consolidated School District Facebook page today. We thank you for tuning in. Whatever mechanism you use, or whether you watch these interviews and our broadcasts after the fact via social media, thank you for being a part of it. Dave Scott, Tyler Keefe in our studios. Thanks for tuning in on 89.3 Lakes FM in West Bloomfield, Keagle Harbor area, 88.1 WBFH The Biff in Bloomfield Hills in Birmingham, WAHS 89.5 Avondale Community Radio covering a ton of Oakland and Macomb County. And thank you also for tuning in on TV, on Civic Center TV, Channel 15, and BAMA, Birmingham Area Municipal Access in Birmingham, Bingham Farms, Beverly Hills, and Franklin. And speaking Birmingham. We are delighted now to be joined by the city manager of the city of Birmingham, Joseph Valentine. Mr. Valentine, good to have you back with us here in the Megacast.
Thank you for having me.
So it's a pretty good day. The restaurants and retail is going to open up and an awful lot more. Stay-at-home order has been rescinded. Your thoughts?
Yeah, good news from Lansing. I think it re-engages our communities. We just have to find ways to do it safely, and I know some of the restaurants are already planning to make that happen. So it's a lot to look forward to in the coming week as restaurants and retailers start to reopen here in Michigan.
Well, it is going to be really great news, and we look forward to, I got to tell you, I mean, I drive through Birmingham virtually every day, and I'm just thinking about the places that I used to go to get a bite to eat or maybe a cocktail after work and some shopping, and really looking forward to spending some time at downtown Birmingham again.
Well, I'm glad to hear that, and that's the environment we're trying to promote here. So we've done what we can initially to try to help with some of the carry-out offerings. Now that these restaurants are able to open, we're hopeful that some of the on-street dining that you're used to, you'll see replicated in a little bit modified fashion this summer, and hopefully everyone will come back out and enjoy their favorite restaurants and dining experiences here in Birmingham.
So as one of the many Michiganders who has a place up north, I've been able to get up there on the weekends and go to Traverse City and Charlevoix and Petoskey and see what they're doing there. Some of them have limited parking in the streets and opened up sidewalks to a greater extent. People seem to want to be able to get outside and dine where they can. Are you working on any special accommodations in Birmingham?
So our initial effort was to put out some streetscape furniture outside the restaurants that were doing the carry-out service to give people an opportunity to sit down while they're waiting for their carryout and make it a little bit more appealing. Going forward, as the regulations with the LCC have been modified, we're looking at expanding some of the outdoor dining opportunities that we currently provide in downtown Birmingham. And then with pending legislation in Lansing on social districts to create drinking areas in designated locations within communities to allow businesses to expand into those spaces, we're eager to see how that plays out. So we're looking at all options at this point. We're working with our restaurant community, particularly trying to find ways to accommodate their needs. So it's all on the table at this point.
City Manager Valentine, I love doing the show and talking to folks like you because I learn things that I don't see reported in the media. Let's go back and rewind just a little bit. Can you tell us a little bit about what the Liquor Commission in the state is doing to consider new rules that'll open things up in the way you alluded to?
Yeah, so previously the regulations with the Liquor Control Commission regulated how far you could go outside your business to sell alcohol. And we have obviously outdoor dining platforms in downtown Birmingham that allow for that liquor to be transported from the business to the outdoor dining area. And recently the Liquor Control Commission relaxed those requirements to allow for some areas that were further away from the frontages of those businesses, those restaurants, to expand the capacity of those restaurants to allow for some of the offset of the requirements for being closed on the inside. Going forward, we're starting to see some additional, like I said, action in Lansing that are going to allow for even further distancing and allow for that license to be used off-site into other locations in the community in these districts. So there's really an opportunity now to work with our business community and find ways that serve them the best way that can benefit them with these various options. And having the support of the Liquor Control Commission is a big help in doing that.
So I know you can't speak for all the elected officials in Birmingham, but do you think there's a willingness in Birmingham to open that up and allow a little bit more activity outside of the establishments? And I'm sure it's not just for alcohol, but for food and other social activities in downtown Birmingham.
Yeah, I think there's a large support of our business base here in Birmingham, and the idea to try to support them in any way we can to make them successful during this summer is something that's been previously supported with initiatives that my staff and I have brought forward to them to consider how to make life a little bit easier in this new environment. Those recommendations were supported unanimously, and they basically asked, what else can we be doing to support our community? And now we're working on those additional efforts.
Well, I think it's great. And it sounds, just from a consumer standpoint, like a lot of fun. A nice way to enjoy downtown Birmingham and open things up. And I assume the retailers, too, will they also be able to use some of the sidewalk areas and an additional space in front of their businesses?
Yeah, we have relaxed our requirements for on-street usage, allowing them to maybe put some promotions outside, some additional signage on the windows, some tents out in the public right-of-way, doing things that make it easier for people to patronize their businesses that normally maybe wouldn't be allowed. But in this environment, we're relaxing our requirements to allow them to be more customer friendly and comply with the regulations that are in place with regard to social distancing and occupancy within buildings, and try to make the business climate here as easy as we can.
Joseph Valentine, the city manager of the city of Birmingham, joining us. Do you see the same thing happening in Rochester, in Farmington, and Novi, Northville, Ferndale, Royal Oak, the other communities that have these beautiful, quaint downtowns in Metro Detroit?
Yeah, a lot of the communities that have the unique elements that we have are doing similar things, trying to find ways to utilize the space that you have in a way that allows these businesses to continue to operate. Because under the prior regulations, there wasn't a lot of allowance for them to expand outside their business. Now that those opportunities exist, these businesses are working with the communities to find ways that meet their needs as specific as possible. So not everybody has the same condition. So not everybody, I can't close every street in Birmingham that has a restaurant on it to accommodate that restaurant, but I can do other things that allow for them to be more effective in serving their patrons and giving them more space, giving the 50% occupancy that they're limited to currently. So each community, I think, is following the framework that's been established, but doing things a little bit different based on how their community is set up and what street parameters they're working with and the uniqueness from each community.
Well, I got to say, it's going to be nice to be able to go into Starbucks at Woodward and 15 and sit down with a friendly neighbor or business associate and have a cup of coffee next week.
Well, that's a big part of this, is that socialization that I think people have been missing for the last 2.5, 3 months, that they can now regain and do so in a safe fashion to kind of relive their lives. So we're excited to see what comes here in the coming months.
All right, well, I'm going to be in Sylvan Lake on Monday for the opening at a restaurant there, but I would like to, if you don't mind, we'll follow up with you or some of your businesses in Birmingham and come out and bring our microphones and do the show live in Birmingham one day next week.
That would be great.
All right. Thank you, Joe Valentine. Anything else you want to add that people should know today?
Just to hit that tune again, that obviously businesses here are opening up, and we encourage everybody to make a visit to downtown Birmingham and patronize your favorite restaurant, retailer, business. We're open here, and we encourage everybody to stop by.
You know, I'm so happy about that news. I would be remiss if I didn't ask you this after just getting off the phone with the folks in Troy and Sergeant Lehman in the Troy Police Department. Clearly, suburbia is not insulated from the news of the day, and I'm sure the police department in your community is keeping a very close eye on everything that's going on.
Well, everybody encourages the public to ensure that they're practicing their First Amendment rights, which they have the right to do. We just want everybody to do it safely. We don't want anybody getting hurt. It's important that they do that. And to the extent that these activities have been happening recently in our community and neighboring communities, we're happy to see that people have done them peacefully, and we're proud of that.
All right. Thank you, sir. I appreciate it. Good to talk to you, and maybe we'll get a chance to have that cup of coffee together one of these days soon.
Sounds good. Look forward to it.
All right, very good. He is the city manager of Birmingham, Joseph Valentine, joining us via Zoom here on the show. Tyler, we got just a couple of minutes. I must say, before we say so long, that as great as all the news has been today, and as many wonderful stories as we have here in Metro Detroit, I am very concerned about our country, and I hope we see the same kind of movement in a positive direction that gives people their opportunity to express themselves, as Joe Valentine just said, but brings some peace to New York, to California, to Seattle, to the other communities that we've seen that have been facing so much trouble over the past 24 hours.
Yeah, hopefully we can find that common ground, and we'll see some more peaceful reactions on top of the peaceful protests, because that's what you need. There's going to be some people that are going to step out of line. There's going to be a lot of people on either side of the coin that are going to step out of line, but it's the people that decide that they're going to be upstanders and that they're going to be supportive of one another and that they're going to listen to one another that are going to make change.
So we'll have a busy day tomorrow. Next week, we're going to get out. I will get out with some of the staff. Tyler will schedule a day for you to get out as well, and be able to mingle in our communities and take the show live. A couple of places next week and celebrate the opening and report on the opening of our communities as the stay-at-home order comes to an end finally here in Michigan. Every day on the show, we take a quick look at our COVID-19 vocabulary. It's a way to keep you up to date on the language and lingo that has been going on during the COVID-19 crisis, and also what we think is an entertaining way to remind you of the things that you can do, even with things opening up, to continue, maybe even more importantly with things opening up, to continue to make sure you're doing your part to help yourself and help our community. Our COVID-19 vocabulary starts with flatten the curve, Tyler.
Yeah, flattening the curve is a concerted effort by the community to take precautions so that they don't see a exponential rise in cases of COVID-19.
Physical distancing.
Keeping a distance of at least 6 feet from other people so that you're less likely to pass on or pick up COVID-19.
What the heck is fomite transmission?
Fomite transmission is picking up the virus from a surface, from something you touch, and that's usually done through the eyes, the mouth, the nose, and the ears, so that's why you're told not to touch your face.
We almost did it yesterday on the radio, sang the happy birthday song for the mayor of Pontiac, who was actually having her birthday. But that's not why we sing the happy birthday song.
No, you sing the happy birthday song in order to make sure you're washing your hands for at least 20 seconds when you're in the restroom.
If somebody has COVID-19, but they are not, this is the Jeopardy version of the game. If somebody has COVID-19 and they are not seeing any symptoms, they are.
What is asymptomatic?
If somebody has the disease, forget it, this is too hard. Pandemic.
Pandemic is the spread of a disease that surpasses nationwide to worldwide spread.
New normal.
The new normal is the new conditions of what we will be living under as a result of what we've experienced and learned in this crisis.
Curbside testing.
That is testing that is quick and expedient. You drive up, you get tested, and you get your results in a couple of days.
It's really too bad that I couldn't do the Jeopardy versions of these off the cuff without any script in front of me. That is truly disappointing. Stay-at-home order.
That was the previous orders issued by Governor Whitmer and by other governors to keep people at home unless they absolutely need to be out and about for work or other activities.
Megacast.
That's not a regular broadcast or a podcast or a simulcast. It's a little bit of everything with community stations involved.
Coronavirus pandemic dreams.
So weird dreams you're having because you're stuck at home, you're not going to work, you're not doing a whole lot, and so there's not a lot of stimulus during the day. You have some weird dreams at night as a result.
An important tip for you as we learn about the non-dominant hand.
Oh, yes. A non-dominant hand is the opposite hand of the one you usually use for most activities. So you want to open doors with that hand, pick objects up with that hand, so that if you do have a scratch on your face and just a force of habit, you scratch your face, you're not using the same hand you use for all those other activities where you might pick up the virus.
Okay, a couple of phrases that have come out of the show the last couple of weeks. Facial covering displacement.
If your face mask is not on correctly, you have facial covering displacement. If it's not over your nose, if it's not over your chin, you're doing it wrong.
What about COVID foot? What the heck is
COVID
that?
foot. That was that. We got that from someone who called in COVID foot. You're out exercising by walking because all the gyms have been closed and you haven't been able to do outdoor fitness classes.
Yeah, they're foot sore.
So you're injuring your foot because you're walking so much. You
All right,
COVID
the COVID 1-2 punch.
The 1-2 punch. It's cleaning surfaces with soap and water and then with your disinfectants.
And every day it seems like we had another one. Today's addition to the COVID-19 vocabulary is COVID monster.
Yeah, the COVID monster is an intimidating, very much angry stuffed animal being placed on surfaces in order to say, hey, wait a minute, don't sit here. We're trying to keep our social distance. Go to the next table.
Right, so you go to a restaurant, there's a stuffed animal, a COVID monster at a table, and then you don't sit there. And that's exactly what you were going to find in Sylvan Lake when we head out for a meal on Monday on the show. As we head out to the grill in Sylvan Lake, where they have COVID monsters on the tables that are not active. It all begins on Monday. Hey, that's it for today. Thank you for tuning in. Thank you to our great guests, Ken Gutman, Dr. Preeti Malani from the University of Michigan, Vicki from the Grill in Sylvan Lake, Dr. David Donaldson of the Beaumont Troy ER, Sergeant Megan Lehman of the Troy Police Department, Joe Valentine of Birmingham. Thanks to all of our guests. Tyler, great job to the crew. We will see you tomorrow morning at 10 o'clock and listen for repeats across the day right here. Have a great day.